This most likely will be a two-part series because I want to be mindful of the time. So let's talk about your normal function of your lungs. Your lungs are two sponge-like organs in your chest. Your right lung has three sections called lobes. Your left lung has two lobes. The left lung is smaller because your heart takes up more room on that side of your body. When you breathe in, air enters through your mouth or nose and goes into your lungs through the trachea, which is your windpipe. The trachea divides into tubes called your bronchi, which enters the lungs and divide into smaller bronchi. These divide to form smaller branches called bronchioles. At the end of the bronchioles are tiny air sacs known as alveoli. The alveoli absorb oxygen into your blood from the inhaled air and remove carbon dioxide from the blood when you exhale. Taking in oxygen and getting rid of carbon dioxide are your lungs' main functions. A thin lining layer called the pleura surrounds your lungs. The pleura protects your lungs and helps them slide back and forth against the chest wall as they expand and contract during breathing. Below the lungs, a thin dome-shaped muscle called the diaphragm separates the chest from the abdomen. When you breathe, the diaphragm moves up and down, forcing air in and out of your lungs. So now you have a little history about what your lungs does. This is a picture of what your lungs look like. Your trachea, your bronchi, the lobes that I just spoke about, as well as your diaphragm. So what is lung cancer? Lung cancer is a type of cancer that starts in that very lung that I just spoke about. Cancers start when cells in the body begin to grow out of control. Lung cancer typically starts in the cells that's lining the bronchi and parts of the lungs, such as the bronchioles or the alveoli. And here's a picture of that. What are the causes of lung cancer? Smoking causes the majority of lung cancers, both in smokers and in people exposed to secondhand smoke. But lung cancer can also occur in people who never smoked and those who never have prolonged exposure to secondhand smoke. In these cases, there may be no clear cause of the lung cancer. Doctors believe smoking causes the majority of lung cancer by damaging the cells that line the lungs. When you inhale cigarette smoke, which is full of cancer-causing substances, which are called carcinogens, changes in the lung tissue begin almost immediately. At first, your body may be able to repair this damage, but with each repeated exposure, normal cells that line your lungs are increasingly damaged. Over time, the damage causes cells to act abnormally, and eventually cancer may develop. What are some of the risk factors? A number of factors may increase your risk for lung cancer. Some risk factors can be controlled, for instance, by quitting smoking. And other factors can't be controlled, such as your family history, or risk factors for lung cancer include, again, smoking, exposure to secondhand smoke, previous radiation treatment, exposure to what's called radon gas. Radon is produced by the natural breakdown of uranium in soil, rock, and water that eventually becomes part of the air you breathe. Unsafe levels of radon can accumulate in any building, including your home. Exposure to asbestos and other carcinogens. Workplace exposure to asbestos and other substances known as to cause cancer, such as arsenic, chromium, and nickel, can increase your risk of developing lung cancer, especially if you're a smoker. And of course, a family history of lung cancer. Signs and symptoms of lung cancer may include the lung cancer typically doesn't cause signs and symptoms in its earliest stages. Signs and symptoms of lung cancer typically occur when the disease is advanced. Signs and symptoms may include a new cough that doesn't go away, coughing up blood, even in small amount, shortness of breath, chest pain, hoarseness that doesn't go away, losing weight without trying, bone pain, and headache. Here is a picture to show you some of those symptoms as well. So sometimes in difficulty breathing, you get easily winded and or shortness of breath. And the chest pain often that gets worse during deep breathing, coughing, or even laughing. So let's say you have these symptoms, you want to go to the doctor. Let's talk about how you prepare for that doctor's appointment. Because appointments can be brief and because there's often a lot to discuss, it's a good idea to be well prepared to help you get ready. Try to be aware of any pre-appointment restrictions. At the time you make the appointment, be sure to ask if there's anything you need to do in advance, such as restrict your diet. You want to write down any symptoms that you're experiencing. Write down key personal information. Make a list of your medications. Gather your medical records. Consider taking a family member or a friend along. Sometimes it can be difficult to remember all the information provided during an appointment. And write down questions you know that you want to definitely ask. What you're going to expect from the doctor when you have these symptoms and you want to see one. Your doctor is likely to ask you a number of questions. Being ready to answer them may allow more time later to cover other points you want to address. The doctor may ask you, when did you first begin experiencing these symptoms? Have your symptoms been continuous or occasional? How severe are your symptoms? Do you wheeze when breathing? Do you have a cough that feels like you're clearing your throat? Have you ever been diagnosed with emphysema or chronic obstructive pulmonary disease? Do you take medications for shortness of breath? What, if any, seems to improve your symptoms, and what, if any, appears to worsen your symptoms? How is lung cancer diagnosed? So now there's a diagnostic that needs to be done once the appointment has been done. Imaging tests use X-rays, magnetic fields, sound waves, or radioactive substances to create pictures of the inside of your body. Imaging tests might be done for a number of reasons, both before and after a diagnosis has been made. And the purpose includes looking at suspicious areas that might be cancerous, to learn how far the cancer may have spread, and to help determine if treatment is working, if treatment is needed or has started, and to look for possible signs of cancer may be coming back or may not, or may be developing. This is a picture of the different tests that may be done, including blood work. Other diagnostic, the chest X-ray is often the first test your doctor will do. Then the doctor may do a CAT scan using X-rays to make detailed cross-sectional images of your body. It can also show the size, shape, and position of any tumors and can help find enlarged lymph nodes that might contain cancer that has spread. This test can also be used to look for masses in the adrenal glands, the liver, the brain, and other organs, if by any chance the cancer may have spread. Other diagnostic tests, they may do a CT-guided needle biopsy. We spoke about the MRI, and they may also do what's called a PET scan. They may also do a bone scan. The results of certain tests may strongly suggest that a person has lung cancer, but the actual diagnosis is made by looking at lung cells in the lab. The cells can be taken from the lung secretions, mucus you cough up from the lungs, fluid removed from the area around the lung, which is called a thoracenthesis, or from a suspicious area using a needle or surgery biopsy. The choice which test we use depends on the situation. Other tests, sputum cytology, again, the thoracenthesis, and the needle biopsy. What are the different types of lung cancer? Doctors divide lung cancer into two major types based on the appearance of the lung cancer cells under the microscope. Your doctor makes treatment decisions based on which major type of lung cancer the person may have. The two general types of lung cancer, one is called small cell lung cancer. Small cell lung cancer occurs almost exclusively in heavy smokers and is less common than non-small cell lung cancer. Non-small cell lung cancer is an umbrella term for several types of lung cancers. Non-small cell lung cancers include squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. This will conclude my presentation for today. I will continue this next week. Please join us in the Zoom room should you have any questions. God bless you and enjoy the rest of the service.